Hey, Dr. Reyes, Tubby Doc here. Let's talk about if your heart rate is too low. You've been dropping weight, you've been working out, and now your heart rate drops below 60. If you look up in the textbooks or the medical textbook, you're gonna be like, oh, a normal heart rate runs between 60 to 100. That's the classic definition. And sometimes you will see heart rates of 50. So let's say you're getting these heart rate monitors and you're taking a look and you're like, oh my gosh, my heart rate used to be a resting heart rate of 90, bad. And now your resting heart rate is 60 and now you're seeing 50 or 40 whenever you sleep. And the clinical question I often get from patients, is that a bad, is that a problem? And the answer is it depends on the situation. So if you're like a 20-year-old and you're a marathon runner, your heart rate is probably going to be in the 50s or 40s, your resting heart rate, because you have great vagal tone. So if you've been working out significantly and you've been improving your cardio and your resting heart rate keeps going down and you don't feel any symptoms, that's the biggest part of it. If you have a low heart rate and there are no symptoms, or you're asymptomatic, is what we say, then we don't have a problem. Now, let's change that context. If you're a 70-year-old person and your heart rate drops down to 50 suddenly, and that's not normal for you, and you're lightheaded, you're dizzy, maybe you passed out, yeah, we got a problem there. Okay, that's an arrhythmia until proven otherwise, and we got to get you a cardiology workup. But if you're otherwise in your young 20s to 30s and you have a low heart rate because you're super athletic, you're doing endurance, not a problem. If you don't have any symptoms, that's the key part, symptoms. The other one is if you're in the 30s, 40s, and 50s and you have a low heart rate because you've been working out more and you don't have any symptoms, you're probably fine, but always see your doctor if you have any questions about it. But in general, if you're asymptomatic and you know why your heart rate has gone down, or you just now started paying attention. On the other end of it, if your heart rate's too high, that probably means you have bad vagal tone or you need a workup.